We're going to turn now to an alarming resurgence of a condition known as black lung, affecting younger coal miners, just as recent firings have hit federal health regulators. Jay O'Brien is in Washington for us with more. Good morning, Jay.
Michael, good morning. We traveled to coal country, what miners proudly told us was also Trump country, just as the Trump administration promises a coal comeback, but is halting some health programs for miners.
This morning, 100 days into President Trump's second term, and these 8 retired miners, all who say they have black lung disease, and most of whom voted for the president, now with a plea for help.
There is no block of coal worth any man's life or woman's.
Many here concerned after 10,000 recent firings at the Department of Health and Human Services virtually eliminated the National Institute for Occupational Safety and Health, or NIOSH, tasked with protecting miners from black lung. And the enforcement of a new federal rule cracking down on dangerous rock dust directly tied to the disease also now paused.
We're going to put the miners back to work.
After his promise of a coal comeback, John Robinson voted for Trump and has faith he'll change course.
I think things are
He's going to bring those
yes,
services
yes,
back.
Yeah.
What happens if he doesn't?
I messed up.
Vital free x-rays and protections for sick miners now abruptly halted, even as doctors in Appalachia are finding black lung is making a brutal resurgence, impacting younger and younger miners.
This guy is 30 years old.
This guy's already passed away.
If you had President Trump sitting here, what would you say to him?
You know, I would say that I understand cutting waste in government, but this is not something to cut. This is essential for the health and well-being of the people that helped elect you.
At this West Virginia dining room table, we found former NIOSH employees now mounting a last-minute pressure campaign to save their agency. And they say the lives of the miners it protects.
If there was a miner sitting here, what would you say to them about what this is going to look like for them going forward?
I'm sorry. I'm sorry for them. I'm sorry for their families.
In a statement to ABC News, the Department of Health and Human Services said NIOSH and its black lung programs will become part of Secretary Robert F. Kennedy Jr.'s new Administration for a Healthy America, or AHA. But those critical doctors and employees are all still laid off this morning, and no response from HHS on how or when that work could resume without them.
So they said nothing about the funding for it?
They say, George, that it will be allocated into HHS's overall budget. But again, they've laid off individuals who have decades of experience here, and it's unclear how they could jumpstart this work again, even without those folks.
Yeah, I know. And I know you got to stay on this, Jay. Thank you so much for your reporting. Really makes a difference.